Hand hygiene is the single most effective method to prevent from healthcare associated infections. Proper hand hygiene prevents from the infection, reduces the hospital stay time and also decreases the healthcare cost. Today, myself Tarika Sharma, along with my colleague Ms. Divya George, are here to talk about why the hand hygiene matters, how to perform it, and when to perform it. Hand hygiene can be broadly classified into three main types, where we have hand rub done for 20 to 40 seconds. We have medical hand wash done for 40 to 60 seconds, and we have surgical hand wash which is done for 2 minutes to 6 minutes.
WHO has recommended 5 moments of hand hygiene, which are before touching a patient, before performing any procedure, after exposure to body fluids or removal of gloves, after touching patients and patient surroundings. Now, let's see when we can perform hand wash and when we can perform hand rub. Remember, hand rub is not an alternative for hand washing. We can perform hand rub only in situations where our hands are not visibly dirty or following physical touch with unbroken skin. In all other situations, we prefer performance of hand washing.
So what are the solutions used for the hand hygiene? We can use alcohol-based hand rubs, which should have at least 70 to 90% of the alcohol concentration. We can also use chlorhexidine gluconate, 2% for the hand rub and 4% for the hand wash. We can also use antimicrobial soap and even the plain soap with water. But remember, plain soap doesn't have any kind of antimicrobial property. It simply reduces the dirt.
Now, before performance of hand hygiene, we have to remember certain points. We have to keep the nails short, remove all kinds of nail polishes or nail extensions, and all the jewelry up to elbow should be removed. Let's see how to perform a hand rub. Each step has to be performed 5 times. Apply a palmful of the product into a cupped hand, covering all the surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of the left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with the clasped fingers of right hand in left palm and vice versa. Once dry, your hands are safe.
Let's see how to perform the medical hand wash. Remember, every step should be done 5 times each. Wet hands with water. Apply enough soap, that is 2 pushes, to cover all hand surfaces. Rub hands palm to palm. Rub right palm over left dorsum with interlaced fingers and vice versa. Rub palm to palm with fingers interlaced. Rub backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands with water and close the tap with elbow if it is elbow operated or with tissue in non-elbow operated tap. Dry hands thoroughly with a single-use towel. Clean hands save lives. By following these simple steps, we can prevent ourselves and also we can prevent the people who are around us.
Hand hygiene is not a habit, it is a responsibility.